to ask you a question. I know this wasn't something we were planning to talk about, but somebody recently commented on one of my YouTube videos that when patients hear from their doctors that they're not a candidate for radiofrequency ablation, that sometimes could mean that it's because their insurance isn't going to cover it. Do you think that that's ever true? Do you ever think that a physician might tell a patient, you're not a candidate for this because of insurance barriers or any other barriers like that are not particularly relevant to their physical condition?
I don't think that they do it because of the insurance, although if I don't want even to think about that. If obviously for the surgeries and the hospital is more convenient the surgeries, but that is to me is unspeakable. I don't want even to think about this. Now, I receive a lot of patients from up north that they're coming because they are being told that the nodule cannot be treated with radiofrequency ablation because the nodule is too large. And so that is also not the case. I mean, we perform, nodules that are very large. That's kind of my specialty. That is something that to answer your question, I heard, but I don't think, and I don't want to think that it's because insurance and money. Is that I think that sometimes the nodule might be too close to the triangle, to the injured triangle, and in those cases you have to do a heavy hydrodissection, put in dextrose to separate it from the trachea, or the nodule is large. When it's too large, they always say, let's do surgery, because when it's large, it takes me a big nodule, a good 1 hour to do the procedure. When the nodule is small, it takes me 15-20 minutes to do it.
Absolutely.
So that is more, again, I don't want to, in conclusion, I don't want to think that this is money related. I think it's more the anatomy related, that sometimes the doctors tell the patient that you shouldn't have the radiofrequency ablation and move for surgery.
I agree with you, Dr. Andrade. I believe that the vast majority of the time when patients are told that they're not a candidate, it's either because they are genuinely not a good candidate for this, or because possibly that physician is not comfortable treating that patient in particular, as you said, due to the size. And I believe that if a patient is going to a doctor that's very new to this technique, that might be a big reason for that doctor's hesitancy, versus a doctor with a great deal of experience, such as yourself, is going to be much more comfortable and confident in treating those more difficult, larger nodules. Would you agree with that?
100%. I agree with you.
Well,
I didn't want to say, but in that way, because I don't think that was ethical for me to say that, but that is what is happening. That's my feeling.